Hello, everyone. I am assuming we're all live right now.
Sir, just wait for a second. We will be starting on our website as well. Just give me a minute.
Yeah, yeah. Okay.
Right. So, welcome all again. Today we have Jammi Pharmaceuticals, the entire team with us once again, and we will be continuing the last week topic that is discussions related to ovarian cyst, and specifically maybe we can have some more discussions on cases like PCOD and some chronic gynecological issues today, and how Ayurveda can the new age Ayurveda. In fact, the topic here is relevant Ayurveda for the new era can help you. So we have Dr. Narsimhan Jammi with us. Welcome, sir, again. We
Hello,
have
sir. How are
Dr.
you?
Anita. Hello. We have Dr. Anita Balachandar with us, and we have Mr. Rachuri Madhusudan as well. And this will be the last session of 2020. So let's hope it will be again a journey as far as the information, the knowledge, and it's a very important topic, by the
Mhm.
way. Let me tell you, today also, like in my OPD, I'm sitting in my clinic. If I count cases from morning to evening, although we are having focus as far as our treatment is concerned for gynecological issues, still we are receiving lots of cases in terms of PCOD, cyst, infertility due to those reasons, and it is growing a lot. So I request all the doctors, uh, please have a focus, and these kind of treatments and these kind of medicines are very much required because compliance is the issue. So if we have Ayurveda in a form of tablet, capsules, syrups, and that kind of stuff, I think that will make life easy for us and for the patients. So, on the same note, let's welcome the team from Jammi Pharmaceutical, and let me request Dr. Nasimam Jammi to take over the session. And I request all the doctors and people who are watching us live on YouTube, Facebook, in Periscope, and on our website, that is indianvadyas.com/webinar. You have any query, you have any question in between the session, feel free to post. You want to connect with the company directly, just post your mobile number and email ID. We will ask the concerned person to connect with you. So let's start the session now. Thank you.
Thank you. Last week we talked about PCOS in particular, and the medicine of choice as far as our clinic is concerned is and all of the doctors who prescribe our medicines is Systivit. Systivit has become a very popular choice of for doctors simply because of the fact that it's a one tablet, and what we wanted to continue with that is that typically we give Systivit in conjunction with another one of our products, which is a uterine tonic, and that's what I'm going to that's something else that I'm going to be talking about today. So just to briefly go over what we went last time, I just want to talk about the basic information that we went over last time is the PCOS protocol using dichloroinositol, which is a very important ingredient found in bitter gourd, Karavelaka. That is as far as one of the most critical ingredients found in Systivit. And this bitter gourd has got very high concentrations of dichloroinositol, and that is really what has made our Systivit such an effective tool. The key is in the way you process the bitter gourd. It's in making sure that you get the right kind of bitter gourd, and how you process it, how you grind it, how you dry it, what is the way in which you grind the whole process. All of this is very important in making sure that the right ingredient is going through. And like we spoke about, it regulates on all four axes. We call it the DAME regulator. D stands for diabetes, A stands for androgen, M stands for menstrual cycle, E for eviction, which is the eviction of the cyst. So basically, as far as the diabetic aspects of things is concerned, it improves the peripheral sensitivity to insulin. It also helps attain normal body weight in obese patients. That's point number one. Then androgen features, hirsutism, acne, alopecia, and all of these things are something that is very, very emotionally and physically disturbing for a woman. That it helps in treating those issues. Menstrual cycle obviously improves ovulatory function. It stimulates ovulation. And then eviction, the most important aspect of this particular thing in terms of getting rid of the cysts from the ovaries, and it ensures the normalization of the hormones. All of this is done by one single product, which is Cystavit. Now, what is really important is that this is something that both adolescent and the women of childbearing age are having to deal with lately, and this contains a wide variety of ingredients. We went over these ingredients. Each one of these things have been specifically chosen, especially the Karela that is meant for regulating the diabetes aspects of things, and the dichloroinositol of the Karela is what has really made our Cystavit such an important tool in dealing with PCOS. And the androgen features in the menstrual cycle, and the ejection of ova, all of these were gone over in detail by Mr. Madhusudan last week. I'm just briefly going over this so that you can refresh your memories about what are all the different ingredients that are there. We make sure that we are very open. Whatever you see in these slides is what is there in the label claim as well. And we've noticed, typically what we've noticed is that a lot of these people with PCOS, and I'm sure all of you in your clinics have had the same clinical symptoms, is that they've had very poor menstrual activity. There is like I was saying last week, some people don't have regular periods at all, and even if they do, it's for a very short time, and they don't have proper bleeding. It's a very dysfunctional bleeding. So many aspects of it as far as their menstrual cycle is concerned is completely awry, and we actually regulate that using our uterine tonic called Suventris. Suventris is a excellent uterine tonic that has nearly 23 different ingredients. It normalizes the menstrual cycle. It corrects various irregularities. It creates a fertile uterine environment. So basically, we've seen that a lot of PCOS patients are obviously having a problem with conception. They are not able to conceive. So what we do is, in order to make sure that this also is addressed, we give a combination of Suventris and Cystavit. It controls also excessive bleeding and relief from symptoms of PMS. Right, so this painful cramps, mood swings, all of these things are addressed by Suventris. Now, this is something that we have very carefully chosen. All of these ingredients. These are the ingredients that we have. Amra, tuna. I will share these on a separate message because I want to open up the discussion for more interactive session where we answer questions that we are able to. But the important aspects of Suventris is that it restores the emotional status of the woman. It is an excellent tensiolytic. It has tensiolytic properties and anxiolytic properties. Kinds of, because of ashwagandha, there's it's an adaptogen, and make sure that the stress is dealt with. It creates a very fertile uterine environment. Like I said, it controls excessive uterine bleeding as well. It reduces the discomfort, the PMS symptoms, and then nidation and full-term gestations are encouraged. And it's an extremely effective uterine tonic. Especially great for patients who have uncontrolled leukorrhea. And this is one of the the most important tools that is there in our clinic is this combination of Suventris and Systemit. And as a matter of fact, I mentioned it very briefly last week, and I've just got this girl to give us a I asked her to mail, WhatsApp me what she had gone through, and I'll just read it out for you. She's 26 years old right now, and she says, I have been suffering from PCOD and thyroid from 4 years. My menses were irregular to the extent of 3 to 4 times a year, and had shorter cycle duration of 2 to 3 days. Apart from this, I had severe bloating and weight gain. In my quest to avoid allopathy, I tried various other medications which gave unsatisfactory results and more frustration. At this point of time, I was no more hopeful of finding an effective cure for my gynecological problems. 2 years ago, I was suggested Jammi, Suventris, and Systovit. Within 6 months of regular intake, not only did the bloating reduce considerably, also the regularity of my periods improved significantly without any side effects. Now I have regular periods almost every 32 days with an average of 5 to 6 days cycle. Also, my weight gain due to PCOD has come to a halt. I'm extremely satisfied and glad with the results achieved, and would recommend Jammi, Suventris, and Systemit for women facing similar issues without a second thought. Now, this is very nice of her to say, but it's not like you can just order it from our website and then start taking it, because you need to consult with us. We have our own way of assessing whether this is something that you how you're supposed to take it. What is it, the frequency you take it? Because we advise people not to take Suventris during the 5 days of the periods. Systemit is to be taken throughout their entire periods as well. But Suventris specifically has been told that you should not be taking it during those 5 days. So it's something that we would really like to have a conversation with the patient to better understand. As a matter of fact, sometimes due to these issues, what people have is excessive bleeding, which is not controlled during this the 5 days. So we give them Laksha to make sure that it controls the bleeding. If for certain other cases where there's extremely long-term bleeding for even like 10 to 15 days, we make another kashayam, and we give it to them. We specifically tailor it to them. So there are a lot of different aspects of a woman's gynecological problems and her menstrual cycle that it's not a one size fits all. Again, it depends from patient to patient. As a matter of fact, I had an excellent conversation with Dr. Mohammed Shahid late last week, and I am working with him to give him medicines for his patient, and we are making it specifically for him, for that particular patient, so that she's been having bleeding uncontrollably for like 10 to 15 days. So for her, it's going to be a separate making a separate kada, so she can take it regularly to calm the system down. So this is basically how we treat. It's typically 80 to 90% of the cases, Suventris and Systemit alone have really helped a lot of cases. As a matter of fact, we have had people call us and thank us and bless us because they've been able to conceive. So that is a great feeling for all of us. But there are people who have problems with excessive bleeding, 14 days, 15 days, and for them we make a separate kada and then we give it to them. So all of these things are dealt with on an individual basis, because it's a very unique, each individual is unique, and we treat them very differently. So I open the floor up to any questions, and anything else that Dr. Anita and Mr. Madhusudan and Dr. Piyush would like to add. The floor is all open to every one of you.
Yeah, Dr. Jammi said it all, so I think we will take questions.
Okay.
Right. So thank you so much, Dr. Jammi, for this. And I request all the doctors quickly, let's have the questions. Prior to that, there are a few aspects which I want to discuss here. And as I am using exhaustively several products from Jammi Pharmaceuticals, including the Systavit, so I would like to add on to certain aspects. See, what happens is, one side we see that, okay, PCOD is a very common problem. It is right now prevalent and many patients are suffering from this. Still, sometimes there are specifically chronic cases. Sometimes the size of ovaries is a bit in the range of say 15, 20. So practically what I have seen and I have realized, we were dealing cases prior as well. I think early this year we have started using cyst have it. So we were doing cases prior as well, and we were getting results. So entire Ayurveda is very effective. The only difference and the main aspect which I want to discuss here is, in fact, there are two, three aspects which we need to understand. First is too many medicines, and medicines in the form of classical preparation sometimes is a bit challenging. However, if it is required by the patients, they can take. By and large, if you do a clinical practice, specifically the private practice, and you have a patient with a hectic lifestyle, and in fact it's a lifestyle disorder, so sometimes they are reluctant, and sometimes it's a bit challenge in giving too many medicines and too many preparations which they need to do. So they are very much comfortable if a single or maybe two or three pills they have to take along with syrup and that kind of treatment. So the word is compliance. So many times we have seen we were not able to get compliance in whatever the treatments we were using. And again, there are very few proprietary or patent products with that much of formulation which are quite effective. Sometimes in mild cases or moderate cases, along with only cystavit we can get results. So that kind of efficacy is there. Otherwise, we can have the other Ayurveda management systems. And yes, Ayurveda is an individualistic treatment approach system. So we need to see every case, and accordingly we need to decide the treatment. Still, by and large, maximum cases are being covered. So that is point number one. Second is diet and lifestyle recommendation and guidelines are very, very important. I always say, and I always request to all the Ayurveda practitioners here today as well, and whatever like you are dealing with. So PCOD, polycystic ovarian disease or polycystic ovarian syndrome, is a very, very specific issue. If not been if not like if patient has not been guided with proper diet and lifestyle aspects, it will definitely will not help them. Because see, what happens is these medicines, these herbs, whatever we are talking about right now, will definitely heal the cysts, will definitely heal the ovary, the size will be back to normal, and symptoms and issues will be relieved, and gradually the patient will feel overall that there is a difference in the clinical condition and the entire symptoms. But again, if they will have the same lifestyle and same food habits, it can reoccur. So that is one thing which we need to understand. And also, when we start the treatment, and along with that, if we ask them and if we guide them to follow the strict diet and lifestyle compliance, uh, that it act as a catalyst, and their healing will be fast, healing will be quick, and they will see the results within few months. And it will be like gradually a I will say I say to all my patients that see, in fact many times they have been told by other fellow doctors that you have to live with PCOD for your entire life. So if they change, these kind of diet and lifestyle recommendations are there. So few I think we have discussed in the last session as well, few maybe today I can discuss and I can share as per our clinical experience and our clinic which we are offering. And maybe you people can add on as well, or many of you are learned practitioners who are listening us today, and something you want to add on, you can definitely in your comment section, we can maybe let's have an interactive discussion today. So any of your experience along with the diet and lifestyle you can add on, and we will definitely share with all the fellow practitioners with your name, so you can add on to that. But we have observed is too much of oil, too much of spice, specifically red and green chili, and too much of citrus khatta, like in terms of chutneys, achars, and these kind of things. So we restrict these kind of aspects in their diet for few months, and we have seen very good results. Second is we change their oil in which they are cooking. So we always recommend in north predominantly. I'm not aware about south. Maybe Dr. Jammi or Dr. Neeta can share on this. What about? In fact, I want to ask. This is my question also regarding the coconut oil. But we have seen in north specifically, many people are using the refined oil and many kind of these oils like sunflower, soya bean, rice bran, and these kind of, which I always prohibit, and I recommend either mustard oil or cow ghee. So when they change this, we have seen very good healing. In fact, in many patients, and we also recommend them to do at least 10 to 12,000 of steps in terms of brisk walking is concerned, and to increase. In fact, I will say a moderate amount of water and fluids. Sometimes many females are drinking very less water, like one or two or three glasses in a day, which is a very less quantity. We ask them to at least have 1.5 2 liters of fluids in a day. So these kind of basic aspects we need to understand, and when we recommend them with their diet, we see the changes, and it acts as a catalyst. And many patients who are following this on strict basis along with the treatment, we have seen good healing in few months. So let me ask first question now. As far as the coconut oil is concerned, what you have seen in, because I know it is very prevalent in South. So does it makes any change, or it matters, or it is fine and like people can take that as well?
No, I think coconut oil is extremely healthy, but then there's a practical aspect to it. Unrefined coconut oil, it's a, the chakki piecing thing. No, that every time I say chakki piecing, I'm only reminded of Dharmendra and Sholay, because that dialogue is firmly implanted in my mind that the check oil is the most is the healthiest oil that you can find. And any unrefined oil, we recommend any unrefined oil, till or coconut or groundnut to a lesser extent, because groundnut tends to make people put on weight. So coconut is extremely healthy. As a matter of fact, coconut oil has been found to be very, very useful in people with Alzheimer's as well. It slows down the progression. It's not a cure, but it slows down the progression of Alzheimer's. So but then the taste becomes very different if you're not used to it. So typically we recommend unrefined oil of either till or groundnut. We don't use too much of mustard oil here in the south, but unrefined oil absolutely is something we talk about. As a matter of fact, we have a lot of people with obesity who don't realize that they actually have PCOD because the periods are normal. And actually, Dr. Prince Girotra, I think this is very relevant to the question you asked. If the period is normal, is there any need to give this uterine syrup? They don't. It does not mean that if they have PCOS that they will have any abnormal clinical. It does not mean that at all. It could be a very silent. For a very, very extended period of time before which it manifests itself. It so happens that they would have gained weight, and they would have gone for a scan, and then they would have found out that they have PCOD. Whereas all of their gynecological functions are normal, like their periods are normal, their bleeding is normal, all of that may be normal, but they end up putting on weight and then eventually end up having a problem with the diabetes. So they actually think it's only a diabetes or a weight related problem, but in reality, after taking the scan, they find out that they actually have PCOS. So we give them a lot of dietary recommendations. We will talk more about obesity at a later point in time. We have solutions for that as well, but that's going to be a completely different segment altogether. But we advise people. We give a lot of clinical advice on what are the foods to avoid. We say go easy on the spicy food. We say go easy on peanuts. Because peanuts are they're very tasty, and without you knowing it, you put on a lot of weight. Then refined oil of any kind, refined flour of any kind, refined sugars, all of this is to be completely avoided. As a matter of fact, as a general lifestyle habit itself, I would say avoid all of these things. But specifically, if you have PCOS, no refined sugars, no refined flour, that is no maida, no atta, that is refined atta. None of these things are to be taken. No refined sugar, no white sugar. So we recommend brown
These
sugar
things
in
are
its raw form.
so we
Hello,
right.
is there a
And the
feedback?
first
Yeah.
right.
So one thing is that your question, Dr. Prince Gilotra, if the period is normal, you had asked whether Suventis has to be given to this patient. You can take a call on that, but Systemit definitely has to be given to the patient. It also has Ashokika and Sanavari Durga in it. And in case if you feel that a support has to be given like a twin engine, then you can definitely add up Suventis. But in case if this is the condition of your patient, one of the patient, you can avoid using our uterine syrup. You can put the patient exclusively on systemic tablets and try out. In case if it is needed, you can add on the second ingredient to that is Suventis syrup.
And the first part of his question, I think maybe we can clarify. As far as my experience is concerned, we have seen cases, and I remember the size was 46, 47 as well. So, as far as cyst
Yeah.
evidence, maybe your experiences, Dr. Jammi, Dr. Anita, and Mr.
Yeah,
Madhusudan,
yeah.
with
45 millimeters. That's quite a big cyst. As a matter of 45 millimeters is 4.5 centimeters. That's quite a big cyst, and we've seen all of those come down. So 45 millimeters is something we've seen very routinely. So
so
the size,
he's trying to ask that how much cyst size we can give this. So, like maybe you can
you
clarify.
can use it any cyst.
There is
No,
no, there is, any cyst size we can give systemic.
Whatever is the size of the cyst, it definitely brings down the size of the cyst and helps out in a healthy evacuation or rejection of the ova.
So, Dr. Prince, you can just quickly share your email ID or mobile number. We will ask the concerned person to be
Please
in
give
touch
your
with you.
mobile number and email ID both, Dr. Prince.
we will share it with you.
We will
And
reach you tomorrow itself.
what about
So we have
DUB and
another question. We have another question from our website participant. We got on our messenger box, Dr. A.K. Sharma. He wants to ask that what about DUB and other menstrual cycle related issues. So we are talking about PCOD, we are talking about cyst, but some cases, and in fact many cases are there. They don't have PCOD, they don't have any kind of a cyst, but it's general DUB cases or general like dysmenorrhea, amenorrhea, or metrorrhea, so many cases are there in terms of the menstrual cycle related issues are concerned.
we give
So
Suventis.
in these cases, how we can take it forward?
Yeah, Suventis can be taken.
Suventis is the real answer for that because you have seen the composition of Suventis. It addresses all these particular things, including leukorrhea, very severe leukorrhea also because of the composition is that. And in menstruation dysmenorrhea, the ingredients used by us is really helpful in bringing down the cramps in the patient.
Right. So I request Dr. Prince and other doctors also who want to get connected with the company, you can quickly share your contact details and email IDs. And meanwhile, all of you can quickly ask any other question you want as far as the PCOD, ovarian cyst, and other gynecological issues are concerned. And there are several questions being already discussed in the last week session. So you can see the last week recording as well. Now, one more thing I want to ask, in fact, to the entire team. We received, in fact, 2-3 questions after the session of last week. So I have noted down in my diary, and I want to quickly check and maybe ask if you people have the answer. Because these questions are not directly related to PCOD or ovarian cyst, but as we are talking, and there are several other gynecological disorders, so we need to understand whether Jammi Pharma is having any solution for that or not. Maybe you can say clearly no, that we don't have any solution. But if you have any solution, do let us know, because we want to cover some additional issues also along with these as far as the gynecological aspects are concerned. Now, the first and foremost, in fact, I remember I have noted down Dr. Shweta. She has asked to us in an email that as far as PCOD is concerned, there are associated issues in terms of acne, in terms of hair fall. We have seen. So, all on the one side, we can always say that yes, when we use steroids to entries, definitely the size will be decreased, and eventually it will be better. But patients need sometimes immediate solutions. And so, is there anything we can use for acne or hair fall as far as Jammi Pharma is concerned?
Yes. Dr. Anita, if you can go, and you're on mute, so please unmute yourself and talk about all of this.
Okay, so we have a medicine, I would say, which comes in form of a cream to help take care of acne that happens, or any other skin-related issues. This is called Clear Marks, and this is actually really a medicine. It's got a lot of jastabasma and gandhaka in it, and you apply it on top of the marks or the pimples or the scars, and over a period of 21 to 48 days, these marks completely disappear. That is as far as acne and other marks are concerned. And we also have oil called Cage Pro, which helps prevent hair loss uh, due to any kind of health related issues. Now,
But in,
these two come under Jummy's brand, but they are marketed under a sub brand of Jummy's called Beautiful.u.
It is
can
there. It
somebody
is there on our website. We will share the link with you. Why don't you? Is Dr. Piyush? Is there a way in which I can share the link here, or is it not possible?
Yes, yes, you can post a
I can.
comment option should be there in your screen, na?
Okay.
Otherwise, you
Okay.
can
Okay.
just quickly send me. I will post
I,
here.
I'm going to do that. I'm going to do that. What Dr. Anita just spoke about. I'm just going to do that right away.
So, Dr. Anita, as you are saying, let me just ask you
Yeah.
because these issues which we are having, in fact, as far as this scar and marks you have mentioned, so any kind of scar or any kind of mark will be diminished by this particular product.
Yes,
Yeah.
it's rather successful in most of these scars and uh, acne marks and all that. In fact, we've had success with reducing the scarring of even a burn patient. Um, like she had her neck and neck region was burnt, and she used these clear marks, and the scarring reduced. I mean, it was obvious. Like she took a photo before and after, and there was a obvious reduction in the scarring.
Dr. Piyush, I
Okay,
have
great.
shared the link for the first one. I don't know how to share it to the other people. So if you can help me out with that, that'll
We
be
have
great.
we have posted. Don't worry, we have posted, and it is there on our all platforms, and we will we have already posted that.
and in fact,
So
if
Oh, you
you
did? Okay.
recall, even in Systemate, you have specific ingredients that address. So you apply this particular cream on the face and internally give the patient systemic tablets. And the androgenic features which are caused because of the rise in testosterone are highly addressed by the ingredients which we just showed about 10-15 minutes back, which are present in Systemate also. A dual this thing,
Okay,
a
Piyush,
topical
I've also given the link for the hair oil. If you can do that, the hair oil actually has got 23 different ingredients in it, and it's one of the most effective hair oils. So one thing that we are very passionate about is this whole concept of cosmetic creams that are out there with the Shah Rukh Khans and the Katrina Kaifs wanting to be more fair and more beautiful. We simply hate that. Okay, we do not subscribe to that point of view. I think God has given us our own skin color. God has given us our own way of looking at things. What we are very particular about is that all of these creams should be completely Ayurvedic in nature. Our creams are Ayurvedic to the extent that even the preservative we use is Ayurvedic. We have absolutely no chemicals, synthetic chemicals whatsoever in our creams and our hair oils. And the hair oil is actually the way we make our hair oil. It's such a laborious process. It takes us about 3 days to make one batch of hair oil because we are very particular that it soaks in it. The paka has to be the right paka. All of these things are very particular. So we're very passionate about skin care. We don't call these as cosmetic products because that's not what we believe in. Because these are not cosmetics; they actually are skin care. So the skin care products that we have are very effective because they're all purely Ayurvedic. Even the cream base that we use is an Ayurvedic product.
In fact, a combination should never be forgotten. The skincare, the product which Dr. Anita was mentioning, clear marks, plus
Doctor,
our
Mr. Madhusudan, we can't hear you. You're breaking up. Can you please put the mic near your mouth and speak?
Are you able to hear me now?
yes,
Very
better.
much.
Hello. Very much. So the combination, internal oral tablets with our cream, clear mark, will definitely help out this patient. There is another question of Dr. Muhammad Said here. Age female,
I've,
36 years,
I've
weight
spoken to him.
70.
Yeah, I've
All
had a very detailed discussion with him, and we are actually very specifically making the cutoff for him, and we are sending it to his clinic.
no, apart from that, in this particular thing, we also have one product called as Thyrogard or hypothyroidism. We can think about our Thyrogard capsules to be added to our systemic tablets and Suventris syrup to correct the menstrual cycle. And whatever Kada Dr. Jammi is sending, I think that should definitely help out this patient. Was it for the same patient you are talking? This is
Oh
being,
no, it's different. Apparently, it's different. Okay, okay, okay.
uh, it is different, no?
Oh, okay.
Hypothyroid.
Dr. Mohammed, this person, we recommend a combination of Cystavit and Suventris, and Thyrogard for the hypothyroidism. So these three things will be the dosage. I'll send it to you. I have your WhatsApp number. I'll send you the dosage. But this is very easily treatable. This is very commonly encountered patients in our clinic as well. So this kind of a patient, so no problem at all.
While you wait for the detailed dosage, off the cuff, I can definitely tell you two tablets twice daily for 3 to 6 months, systemic tablets, and 10 ml of Suventris syrup twice daily for the required number of period, and Thyrogod capsules to be complemented for about 3 to 6 months time.
Right, and in fact, Thyrogard I am also using, and it's a very good product. Again, we will have a specific session on hypothyroidism also, and we will be discussing on that product. I have seen very good results as far as Thyrogard is concerned, along with Kanchnar, Varunadi Kashayam, we are using, and it's a very good product. So we will have that. Let's park this discussion to that section. Meanwhile, continuing with that, associated issues and health issues related to gynecological aspects, there is one more specific issue which we are dealing. Although we are able to manage that in our clinics also, still I want to explore and I want to understand if Jammi Pharmaceutical is having any specific product for that issue. That is a problem of white discharge leukorrhea. We have seen in many females, along with PCOD also, or sometimes in between the both cycles they are having, and it's also sometimes very chronic, and many females are not able to heal that. Although we are using certain medicines, classical preparations also in Ayurveda, and we are getting good results, but still I want to ask, because it has been raised by one doctor from the last session. So maybe let us know, Dr. Jammi, Dr. Anita, if we have any solution for that.
Absolutely. Suventris is specifically recommended for leukorrhea. I'm sharing the screen. If are you able to see the screen right now? Not yet, right?
I think it is just going. Yeah,
It's
it
here.
is up here.
Yeah. So if you look at this,
Yeah, we can see it.
you can see the screen, right? So
Can you make it full
Suventris-
screen?
I'll make it 1 second. Just 1 second.
Yes,
Yes.
better.
Okay. So if you look at it, the Suventris is specifically meant. If you look at it, I'm pointing at the thing over here. Leukorrhea is one of the most important things that we treat with Suventris. Suventris is for all aspects of your mental, especially leukorrhea. We found that it works really well. So
The three specific ingredients named Ashoka, Lodra, and Shalmali, which are there in our Suventris, are specifically found to be highly effective in the management of leukorrhea. Lodra,
Right. Lodra
Shal-
definitely is.
Lodra, Ashoka, and Shalmali. These are the three this particular things.
So with Suventris, Dr. Jammi, how much dose and how much duration can we expect, and can we think as a clinician that it will heal the specifically? Let's have one standalone case only. Leukorrhea is there in a patient. So how much dose and how much duration can we expect that it will heal?
10 ml twice daily. There's a cap that's provided with the bottle. So that cap is 10 ml. So 10 ml twice daily. And it is to be taken every day except for the days on which she has her menses. So approximately 25 days a month, she has to take it. And we expect anywhere, depending upon how chronic the case has been and how intense the problem is, anywhere from 3 to 6 months.
And as far as cystavit is concerned, can you just repeat the dosage as far as PCOD, ovarian cyst, and any other gynecological indication? Is it same or is it vary as per the health condition? So can you maybe let us all of know about the dose?
2 tablets twice daily. It's the same for everybody.
3 to 6 months. There is no cycle because there is no cycle till my menstrual cycle normalizes.
It gets
We give it.
regulated. We have to continue taking it.
We have to give it in the month basis, 3 to 6 months time. And majority of the cases, as Dr. Anita was mentioning last time also, it has come to normalcy within 3 months itself. And in case if it is severe, you can tag on the second engine of Suventris also for faster menstrual cycle restoration.
Right. In fact, we generally using 2 tablets TDS 3 times a day, and we are
Oh,
getting. In fact, we are getting results in 2.5, 3 months as well.
oh,
Matlab,
then
means
we
the
will also try the same thing, Dr.
complete
Piyush. We will do
resolution.
the same thing.
In fact,
In
I have
fact, if
shared.
you see, yeah, in fact, if you see Dr. Piyush and others also, despite even if though we wanted to recommend 2 tablets TDS for the first 3 months, but we set that across because there were sometimes people may miss it on. So we stick to that particular thing. 2 tablets 3 times daily for the first 3 months would be the ideal one. And despite that, per day's treatment with Systovit, say for those say 6 tablets you take, is not more than 32 rupees.
Yeah, it's very economical, by the way. Absolutely, it's very very economical. Great.
I'm
So I
talking
think
including taxes.
right, nice. So I think we were able to address some aspects as far as PCOD and ovarian cyst is concerned today. I would like to request. Right, 2 TDS appropriate dose. Dr. Joshi is also advocating the same. So I think
Okay.
today we were able to address certain aspects and certain issues, and it's a very common. I will say it's a very common and a very prevalent health issue. I remember day before yesterday, I got a call from Hindustan Times, and they are maybe want to publish some story about PCOD, and they were taking some inputs, and I just discussed with them. They have done some research, so it is spreading like an epidemic these days in our
Mhm.
country, and
Unfortunately.
the data is horrible. So if you see, some studies were there, we discussed in the last session also. So each and every family now we have seen any one female is suffering from this kind of issue. So and by the way, the solution is in Ayurveda only. So we have seen, and I have seen failures of so many pathies. People are trying, and they are not getting results, and within few months results are nowhere. We can say that okay, homeopathy also there, but it takes some years as well sometimes. But within few months, only Ayurveda can help them in the complete resolution, in the significant decrease in the ovary, in the cyst size and the ovary size, as far as the ultrasonography report. That only possible with Ayurveda. And if you are sitting in a private practice, you can't avoid that. Patients are very well aware these days, and they need results to be visible. So on one side, yes, definitely the symptoms will be relieved, but on the other side, if their ovary size is not getting decreased and their cyst and other aspects are not getting healed in the ultrasonography report, that is also a challenge. And sometimes we have seen, in fact, that is one experience I have. In past, I have seen many Ayurveda permutation and combination and treatments, that patients are getting relieved in their symptoms, but somehow their ovary size or cyst is not getting decreased. But with this, adding these products, we have to we have to address that aspect as well. uh,
Can I add something more?
there is one more question. Okay, yeah, please, please.
Yeah. Particularly, we have been talking about PCOS, particularly in adolescents as well as in women of childbearing age. one particular age group we have to really focus upon, because that is the growing population, and the cause of concern is the teenagers, particularly with the lifestyle changing and with the number of children that per family having now, and also the consumption of all junk food. The menarche setting nowadays is between 9 years and 10 years, whereas average about 30 years back used to be 14 to 15 years of age. So the mothers who have just got these children, what happens is, it is found, statistically is found that they have the first menarche when they are about 9 or 10 years of age, or 11, and they have 1 or 2 periods. The mother is also very much worried. अरे मेरा तो 14-15 साल में हुआ था, इसको अभी अभी हो गया, अभी क्या करें? So she is very much worried. So she takes care, gives all the precautionary cautions needed to the child. But after 2 cycles, the child stops having menstrual cycles. The mother is also a little bit comfortable. अरे अभी तो छोड़ो यार. Then she takes, after 3 months, when it doesn't happen, she comes to a doctor. 3 महीने से 4 महीने से नहीं हुआ है, डॉक्टर साहब क्या करें? So the doctor says that let us watch for another 3-4 months. So when it doesn't happen, it is already about 4 to 6 months. This particular episode has happened. The child after the second menstrual cycle doesn't get the cycle back. And after 6 months and repeated things like this, you find that the child has gone in. When does the doctor really wake up, or patient really wake up? When the androgenic features like acne comes on the face of the child. Hirsutism comes in. There is a coarseness in the voice. The patient and the mother wakes up and they do the USG and they find there are cysts. And it takes almost 6 months to 1 year before it is detected also. And in some cases, even till 3 years, this episode is not detected, and by that time, the cysts have grown up. So let us, my suggestion is that let us read from this particular episodes happening across the country and across the world. Let us take this particular condition of the teenager very, very seriously, because it is a real concern for a growing child, and address these things as it really is reported in the first or second instances.
Dr. Piyush, are you there?
Yes, yes.
I would like your input on Dr. Monica Gupta's question. Good evening to all. Please discuss about primary infertility. If patient initially suffering from PCOD, but now she's recovered, but still suffers infertility. I would like to know your take on this.
Absolutely.
What would you recommend in such a situation?
See, Dr. Monica, actually, we need to understand what are the various causes. See, infertility, in fact, primary infertility is a very complex aspect. We need to see several issues and several aspects when we are dealing with the infertility cases. So, what happens is, suppose we got this case in which initially it was PCOD, but now she has recovered. So, what happens is, after the recovery, we need to check first whether the menstrual cycles are also normal or not. Second, what exactly the egg is getting matured. We can do the follicular study. We can use the latest technologies and tools. So that is, follicular monitoring is very, very important, because there are medicines and there are treatment protocols in which we can improve the quality of egg. And we have seen with Cystavit and Suventis, and along with other Ayurveda medicines, it has improved as well. So that is second aspect. Third aspect is, we also need to see if there are concurrent issues, like for example, is there any kind of a discharge is also there, like leukorrhea or any other kind of discharge, any other local infection is there or not. So that we need to understand. Fourth, sometimes we have seen what happens in the Indian scenario. Generally, they blame the infertility to females only, and they only focus and only do the treatments of females. And sometimes they have recovered completely, but still they are not able to conceive, and nobody is bothered to check the male status, their semen analysis, their testosterone level. So that is other aspect which we need to understand. When we need to check the semen analysis report many times. Count is fine, but motility is the issue, morphology is the issue, local level infection is the issue in males. Now suppose if these aspects are also fine, now the third aspect which I think many doctors are not at all discussing that either wife or husband are able to make the relationship in a normal manner or not. So due to the social stigmas, or sometimes many cases are not being discussed, we discuss the entire thing in our clinics, and we have found in many cases of infertility, they do not know, lack of awareness is there in our society. They do not sometimes know how to make a successful relationship to achieve the fertility and to conceive. So these are the basic protocols and basic aspects which we need to understand as a clinician, and we need to discuss with all our cases, and we do in our regular clinic practice, and we see that we are getting very good results. And if you have any specific case still, I think you have my email ID, number, all the details. You can directly let me know, and I can help you out in any specific case you have, and accordingly we can take it forward. But apart from that, by the way, along with PCOD, you have to also check the uterus. Is there any fibroids are also there? Because any structure present in uterus will not allow the lady to conceive. So that is also one more aspect you need to understand. You also need to check the sometimes as the fallopian tube blockage aspects are also there or not. So you have to done a investigation for that as well. So you need to check so many aspects whenever you are dealing with a case of infertility. Age factor is also one aspect which you need to understand. Also the history, sometimes we have seen these days, especially in the urban populations, many times female has taken the exhaustive intake of hormones due to several issues in their like when they were single before the marriage, and they have taken maybe from chemist shop or from unqualified doctors, or that kind of stuff is also there, and then they are not able to conceive. So history taking is very very important, and we need to understand and keep in mind all these aspects whenever we are dealing with infertility case. Sometimes counseling, discussing with the entire aspects with wife and husband both is helpful, and it helps in achieving the goal of making them parents of a baby. So that kind of stuff we need to discuss along with other aspects, and it's a very wide topic. By the way, we can have maybe one session on infertility, because we are dealing regularly with all these cases, and accordingly we can take it
Dr.
forward.
Monica,
In
another
fact,
thing very many people don't focus on is diabetes, because if you have very high blood sugar, you will have infertility without, and they may not even know about it, because they think it's PCOD, it's over. But diabetes is one of the leading causes of infertility in women, and that's something that they should absolutely bring under control, because you may be completely normal, but if you don't have control of your blood sugar, you will not conceive.
So PCOD also, like we can expect, as we have seen, around 5 to 6 months. There is a question from Dr. Amit as well. So is the same time we can expect, as far as and chronic? I think we may be talking that people are suffering from so many years. So maybe 6 to 8 months can be the duration. Dr. Jammi, Dr. Anita.
yeah, 6 months would
Yes,
be
we,
ideal.
we,
6 months.
we
Dr.
should
6 to
Habib
8 months.
Razvi,
Yeah.
can you please share me your mobile number? Every time I try it, I'm not getting it.
I think he has already shared in past. I will share with you.
No, I checked
I
up
have
all the videos. Yes, I'm not seen it.
No problem. I have his number. Dr. Amit, if you are listening, you can quickly share your details also here. We will connect the concerned person to you as well, and you can take it forward accordingly. Right.
In fact, for the though it is extended, but for the quality count and the motility, we many of the doctors who are using System, they really call the husband wife the team together, and sometimes we have
Please keep the
another
mic.
product which is
Please keep
called
please keep the mic near your mouth.
uh, the cover the partners are called for advice by the doctors, and in case if there is some issue with this particular count, motility, and also the quality, they have been prescribed our Vidari granules also, which is quite a useful preparation, particularly to address the male infertility cases. Anyhow, we'll talk about it next, but this time it is Sister Witten's.
We will talk about the male
Again,
related
We'll
in the
definitely come
next.
back to you.
We
Male
have case
related.
studies that we can talk about
Next week we
male
can talk.
infertility issues.
Yeah, I think
Okay.
we can continue and we can have maybe with Ari Ford and other related aspects in the next week session, because then it will be a complete series as
Yes,
far as
yes.
is there any other product, by the way, as far as male health is concerned, apart from Vidari Ford?
No, as
Sorry,
of
what was the
now,
question again, Dr. Piyush?
we are still in the
What is the
pipeline.
question?
Male
Apart from
health is concerned, is there any other product apart from Vidari Ford?
No, we are bringing it out. We are getting it, getting the approval of the controller, and once that's ready, it'll be released, launched.
the delays
Fine.
at the drug controller.
Yeah.
And one more aspect, one more question, in fact, was there in the series of questions. As far as uterine fibroids are concerned, so we understand, and I know as per my clinical experience, again, there are so many medicines which we are using in Ayurveda, and there are some therapies also. We are doing Vasti Chikitsa, and some kind of Uttar Vastis are also very effective. Still, I want to understand, as far as uterine fibroids are concerned, but exactly you people have the experience with your doctors, with these products or maybe any other product you people have. Is there any treatment protocol we can suggest right now?
Dr. Piyush, what we found is that Systemit seems to work with the uterine fibroids very well. What I will do is I will have one of the doctors come and give a talk about the uterine fibroids. He uses Systemit extensively, and I will make sure that I will find out his availability on Tuesday nights and have him talk about specifically uterine fibroids, because that's also a very common problem among a lot of women, and he buys a lot of Systemit and prescribes Systemit for uterine fibroids. I will have him do it because he's the expert on this.
Right,
In
right.
fact,
So,
I'm meeting one doctor on the 31st again. He is also using extensively Systemic, and particular. I would like to take his evaluate his particular views, and let us see whether we can bring him in also.
great, great. And
Yes.
Dr. Hamid has shared his contact details. So, Mr. Madhusudan, maybe you can note down his number,
One
and
minute,
accordingly,
I'm
we
right.
can
One minute, one
I,
minute.
take
I,
it
have, I
forward.
have noted it down. I have noted it down.
You have
Thank
noted
you.
it down.
And Dr. Monica, I have shared my mobile number as well as you have requested, so you can maybe discuss your case. You can WhatsApp me on this number, and accordingly we can take it forward. So I think it was an excellent again session today, and thank you so much all of you for joining us. Again, we are very much and there is a request that next session please discuss on uterine fibroid. So maybe Dr. Jammi, you can quickly check with that particular doctor
I will. I
if
will. I will. If
next
not next
Tuesday.
session, we will do it soon enough. But next session we'll complete the whole. We'll make it. We'll have the complete session. We'll talk about male infertility and male sexual problems, so that we have a complete holistic solution for both men and women.
Right, right, right. And then maybe next to next week we can have uterine fibroids also if possible, because
Yeah.
it's a very important and again it's growing at a very speedy, I will say, way, and we are seeing so many cases as far as uterine fibroids are concerned. So thank you so much again to all of you for joining us. We are looking forward for a great 2021 with all of you, and we are very much excited and very much pleased to know that Jammi Pharmaceuticals are having certain plans. So I quickly, without taking much time, I quickly request Dr. Narsimham Jammi and maybe Dr. Anita and Mr. Madhusudan wants to add after he will let us know. So what exactly Jammi Pharmaceutical is looking forward as far as 2021 is concerned? Any information you can reveal right now? Any new product launches, any other maybe plans for 2021? So maybe quickly we can have some piece of information from you today.
Yeah, product launches. I will defer to Mr. Madhusudan because he's the director of marketing. So I'm up to you, Mr. Madhusudan. Whatever you want to say, please go ahead and say it.
Anyhow, it should be a curtain riser for 2021. Okay, before I go into that, on behalf of the entire Gummy team, I wish you all a happy new year, which is going to come. And a range of products from Gum is coming, addressing mainly towards the lifestyle management. We are coming out with an excellent product for obesity, which is going to be unique. And we are coming out for a cardio tonic, which you will all really fall in love with, and your patients will have a healthy life, a healthy heart to go for a healthy life. We were coming out with a product exclusively for benign prostatic hyperplasia, and we also have a plan to come out with a topical application as well as or particularly oral supplementation for psoriasis.
You
This
broke up,
one,
Mr. Madhusudan. Could you please repeat the last point again? You broke up. Mr.
we are
Madhusudan, you
coming
broke
out
up.
with a dual combination, a topical application, an ointment or a cream, or it will be either mostly a ointment, I think so, and also a oral tablet to be for the excellent management of psoriasis. We are definitely coming out with it. And I think there is one more product, as we told, we are coming out for our product of migraine care for migraine headaches, which Dr. Anita was mentioning in the first instant. When we, on the 10th of November, we did make a mention about it. These are the immediate 5 products I would like to highlight or reveal immediately on this forum. In fact, we have not shared this matter even with our own field staff till date. Okay, because we have kept it in wrap and we want to share all these things on the new year because Dr. Jammi wanted me to share it. And on this platform, I'm definitely sharing this particular 5 beautiful now this thing coming up. And we have a lot of other things up our sleeves, and we will definitely reach out for the benefit of mankind. Thank you.
Great, great. Thank you so much. And Dr. Jammi, any other aspect in general from your end as far as Jammi Pharma is
Yeah.
concerned? What exactly you and Jammi
Yes.
Pharma is moving forward for 2021?
So we are actually coming up with a very, very unique teaching program for all Ayurvedic Vaidyas, students who are still doing the BAMS, and Ayurvedic Vaidyas of all specialties. What we're launching, Dr. Anita and I are launching a series of classes and courses on immunology, biological chemistry, genetics, and molecular biology for Ayurvedic Vaidyas. The key here is this, right? I think Ayurveda has got so much to offer to the world. It becomes a problem for a lot of us when we are not able to communicate Ayurveda in the way it ought to be communicated. We cannot try to explain Vata, Pitta, and Kapha to allopath because they simply won't take it, and you have to communicate to them in the language they understand. Now, somebody can come back and say, hey, you know what, why should we do what they want? Why can't we just stick to Vata, Pitta, and Kapha? So the goal here is not about ego. We cannot say, you know what, I don't want to talk about the molecules and the pathways. We can't do that. Our goal is to popularize Ayurveda. Our goal is to make Ayurveda more reachable to the entire segments, whether it's online study course, Dr. Joshi, whether it's allopathy or homeopathy or any other pati. We need to make sure that allopathy, Ayurveda is completely available to everybody. And the way you can do that is to communicate to them in the language they understand. Right now, people understand pathways and molecules and things like that. And given that we have expertise, we're both the PhDs in molecular pharmacology. Dr. Anita has PhD in biochemistry and genetics. We want to do these online courses. We want to talk about the basics of immunology, basics of molecular pharmacology, basics of biochemistry, in a way in which the Ayurvedic student, the Ayurvedic Vaidya, is able to strongly, more confidently, more vehemently argue his case to a lot of people. So we are, as a matter of fact, we have already planned the course content. We need to fine tune it. It's going to take us a couple of months. We are planning on a March launch for these courses, and there's going to be separate modules So we will announce it on Indian Vaidyas once the course content and everything is ready. So this is a very, very unique offering that we are doing, because we want people to be able to communicate in the lingua franca of modern day society, and that is modern science.
That will
This is
make
what I want to
Ayurveda
share.
more stronger and the practitioners of Ayurveda more uh, confident in talking as equals with other fraternity also. I have one more
I,
good tiding to share with you, which for the 2021 we can say. I am proud to announce that Dr. Jammi and Dr. Anita have been appointed as adjunct professors for DPSU.
DPSRU,
Yes.
Delhi Pharmaceutical
DPSRU,
Sciences University.
DPSRU,
Yes.
adjunct professors for DPSRU.
Great, great. Congratulations to both of you. And we are looking forward for many more informative and enlightened sessions from all of you. And we are pleased to have you on our platform. And we would like to act as a catalyst in disseminating this entire information to our fraternity. So thank you so much for this association. And we are very much privileged and very much honored to have this, I will say, learned group of professionals, Dr. Jammi, Dr. Anita, and Mr. Madhusudan. And we are looking forward to have many more like new milestones to be achieved. And Mr. Madhusudan, we will definitely request you to launch each one of your product on our platform as well, so
Oh,
that we can
absolutely.
disseminate to the entire fraternity. And
Definitely.
congratulations once again for all these
We are
pipelines.
privileged.
And, yeah, and as soon as all these will be available, it will add value to our clinics, and we will definitely take it forward and will be able to heal the patients. So on the same note, let's wrap up the session for today, and have a very happy New Year to all of you. And
Happy
let's
New Year
meet
to
in
each one of you.
Happy
right.
New Year,
Let's
everybody.
yeah, let's
Happy
meet
New
in
Year
the
to
New
all of
Year.
you. Have a
And
wonderful
to all,
2021.
yeah, thank you, and
Thank you.
to all
Corona
the
free
audience also.
2021.
Right. So
Absolutely.
we are
Yeah,
already getting some queries as
I
well,
will
so
contact.
we'll
I will
definitely
contact
announce
you.
the online course as well. Right.
Yes.
Yeah,
Thank
will.
you.
Absolutely.
It is
Yeah.
going to be a beautiful course. Online course is going to be a beautiful course, and it is going to be a beautiful modular one, fine-tuned for the current scenario, which a futuristic look to that.
Right.
And you
Great.
have two adjunct professors who are going to be the faculty
Yes.
Great.
there.
Thank
We
you.
hope to be able to do that. Thank you. Thank you very
Right.
much.
Thank you.
Thank you
Thank
all.
you all
Have
of
a great year. Thank you.
Good
Thank
night.
you.
you.
Good night. Thank you.